is being recorded.
A very good evening to one and all. Welcome back to the today's session. Today we have our guest speaker, Dr. Shanthi Narayanan ma'am, Professor, Department of Organon of Medicine from Vinayaka Mission Homoeopathical College. And over to you, Ashika.
Good evening, everyone. So once again, welcome you all to HomeoVision webinar series organized by All India Homeopathic Student and Youth Association. So today's topic of interest will be empowering homeopathy, the role of young clinicians in primary healthcare delivery. So, giving a brief introduction of ma'am. She has completed her undergraduate studies at White Memorial Homeopathic Medical College and Hospital, Atur, and pursued her postgraduate degree at Sharda Krishnan Homeopathic Medical College. And she has 12 years of teaching experience and 20 years of clinical experience. Currently, she is pursuing her PhD at Vinayaka Missions Research Foundation, Salem, and she has presented several papers at national and international conferences. She has been recognized over the past 3 years by Lions Club for many active service in creating awareness on cancer, nutrition, and breastfeeding. In addition to her academic clinical work, she is also a small scale entrepreneur for past 3 years. So we all welcome Dr. Shanthi Narayanan ma'am. Over to you, ma'am.
Thank you. And good evening, everyone. Hope my voice is audible to all. Yes?
Yes, ma'am.
Yes. So today's topic is a little bit interesting and very short too. Why? Because empowering homeopathy, the role of young clinicians in primary healthcare delivery. So after completing BHMS, this talk is about how young homeopathic doctors can make homeopathy stronger and more useful in basic healthcare by using their energy, new ideas, and modern tools. A clinician who can help more people, especially in rural and needy areas. So that is the topic today. And coming to the introduction, homeopathy and primary healthcare. Homeopathy, one of the world's most practiced holistic systems, as you all know, and it is playing a key role in addressing community health needs, where the primary healthcare will be the first point of contact for a patient. And being as young clinicians, bringing energy, innovation, and adaptability. This is what they need. Actually, adaptability is something like adjusting oneself to new conditions, changes, and challenges quickly and effectively. I mean to say, like adapting like a chameleon, for example, changing its color according to the surroundings, and being so flexible, open-minded, and ready to face unexpected situations. Just let me tell you a cutie story. Like imagine an young doctor who starts working in a rural primary health center. On the very first day, she'll be expecting fever or common case of cold. But suddenly a pregnant woman is rushing for a labor, but there is no specialist and no advanced equipment. But only her presence of mind should work there. And she quickly recalls her training actually and uses the available sources which is present and safely handles the situation until the help has been arrived to her. So this is called adaptability, the courage and the flexibility in handling unexpected situations and challenges. So that is what our young homeopaths need. And also contributing to a better patient outcomes, taking their need of them, taking care of them. So all these things gives them a good healthcare delivery. So actually, what is the current status of homeopathy in healthcare means 80+ countries worldwide are practicing homeopathy, and who has recognized a leading complementary medicine, homeopathy, as a complementary medicine. In India, Ayush integrates homeopathy into primary health care, growing acceptance due to its holistic, cost-effective, and safe approach. And coming to the whole, India stands 45% of leading usages. So think about it, Latin America and North America only 10%, and Europe 25%, and rest of the world only 2%. So here we'll have to improvise more. Integrating homeopathy with Ayush primary health care, we need to improve more. And here coming to the homeopathy in healthcare. So we all know it is safe and gentle, which has got a minimal side effects, cost effective, affordable for all sections of the society, like which is rich or poor or in the below average. So it fits to all the members of the society. And holistic approach, hope you know, treating a patient as a whole and not just as the symptoms. And patient-centered care builds trust in doctors and long-term healing. They trust you fully. And effective and preventive care, boosting immunity, reducing recurrence. Hope our medicine gives you cure. And valuable in lifestyle disorders such as stress, allergies, and metabolic issues. So we people treat lifestyle disorders too in homeopathy and in also the primary care. So what does this young clinicians, what do they do is energy, innovation, adaptability. Innovation means like bringing up with fresh ideas. They are being enthusiastic and they are involved more in clinical research, which generates more evidence in homeopathy. Ability to connect with community and patients, and most probably tech savvy, digital health, and telemedicines. So tech savvy in the sense meaning comfortable, skilled, and knowledgeable, and also using technologies like computers, smartphones, apps, and digital tools. So these are what young homeopaths needs, right? And also the people. So say for an example, if a librarian is an old person, so think about government libraries. People who are posted old, they doesn't know how to operate computers actually. So they'll be writing ledgers, long notebooks for entry, exit, everything. But nowadays it has become a digital library, right? So people are trying to learn something new. So here, this tech savvy is new in this field, where young clinical homeopaths can make use of this digital health and telemedicines, okay, to solve the problems of daily life or work, which is being a hurdle to us, okay. So these things they can do. And then coming for just to be more practically speaking, a teacher who uses PowerPoint, Google Classroom, Zooms effectively for presentations to understand, make them students understand in a better way. And also a doctor who uses digital records, telemedicine, health apps nowadays, right? So all these things digitally, people are getting modernized. So young homeopaths should be skillfully thorough with all these things. That is comfortable with technology. And this one can improve today's healthcare, right? And coming to digital health, again using apps, wearable devices, and health records on computers and phones. Then monitoring the patients and tracking the devices and keeping the medical data, which is safe and organized. Coming to the telemedicine, nowadays people take case through online. When we people studied VHMS, there was no telemedicine. So we'll have to look at the patient. Nowadays, even patients from remote areas can contact doctors. So really it is improving modern technology, right? So consulting patients online through video calls or messages or apps. So this one helps people who are in villages and remote areas. those who couldn't able to reach hospital. Then coming like, so for example, if patient is suffering from blood sugar. So through mobile app, you can get advice about diet and through the follow-up consultations over a video call, right? So it is cost is reduced as well as it is time saving and also making healthcare more accessible. Okay, fine. So coming to the next slide, for something like young homeopaths, what they need, a strong knowledge of Organon and Medica, research mindset and evidence-based practice, communication and counseling skills. So starting to the knowledge of Organon and Medica, detailed case taking, understanding not only headache symptoms but also her stress, moreover sleep and food habits and emotions related to her headache. So think a woman of 25 years old coming with a chronic migraine headache, and she has taken several treatments before but has got only a temporary relief. Through the medical knowledge, you'll be able to know the medicine, Natramure research medicine, where the headache is worse during sun and emotional suppression, and she has a desire for salt. So you choose a Medica Natramure. And here, research mindset, in the same thing, research mindset, what it happens is you will have to make it an evidence-based practice. So collecting a pilot study of 5 to 10 cases who is suffering from chronic migraine, and you'll have to note them on what medicine you are giving them, what are the changes in symptoms, and what are the inclusion and exclusion criteria you have been recording it. So all these things gives you an evidence-based practice as well as the research mindset. This is called developing our research work and making it evidence-based. And finally, communication and counseling skill. Actually, we, being doctors, we need to talk, right? And while talking, we need to give them trust. And moreover, we need to tell them about stress management for headache and what lifestyle changes the patient has to put on it. So these sort of a thing is what an young homeopaths needed at present. So after a period of 3 to 4 months of recording all these symptoms, we'll be coming to know after taking a homeopathic medicine, there are a reduction of symptoms and the quality of life has been improved. So that is what we need, right? And coming to the primary healthcare, integrating with Ayush and government schemes, community health programs, rural and urban outreach. So as you know, Ministry of Ayush in India promotes Ayurveda, Yoga, Unani, Siddha, and homeopathy as a part of holistic healthcare. Hope you must be knowing about Ayush systems. So I need not explain much about Ayush, right? And here, homeopathy is integrated with National Health Mission, NHM, right? So in primary health centers, PHCs, and community health centers, CHCs, patient can access homeopathic care also along with allopathy. And most probably in community health problems, National Ayush Mission NAM strengthens Ayush institutions, supports Ayush hospitals, dispensaries. And moreover, if you are starting an Ayush hospital, right, or a homeopathic hospital in future, and this NCH is providing fund. Okay, so we can make use of it also. And promotes local health traditions. School health programs, so getting to the reach of the children's and preventive care. So why this? Because homeopathy is used for preventive care in children and anemia prevention and lifestyle disorders prevention. So these things will be well done in community health programs, right? And coming to rural and urban outreach services, Ayush doctors whom you know, posted in remote and rural areas to improve accessibility. Like you should have skills in various departments, not alone DHMS is enough for working in a primary health center in remote areas. So why? Because homeopathy is no longer an alternative system, but a part of government-backed healthcare delivery. Of course, benefiting rural and underserved population through Ayush integration. So we need to be skillful doctors here afterwards. And this Ayush service in slum areas and urbans and villages. These wellness centers, what do they do is through NHM, National Homeopathic Health Mission, right? So they are providing preventive, promotive, and curative care. So altogether, this primary health care, a young clinician should have all these skills to handle the primary health care. And coming to the next slide, what are the challenges which are faced by young clinicians? Lack of awareness and recognition. And of course, lack of awareness is there. Why? Because still now people in rural areas, they doesn't know about homeopathy. So it is really hard for them to face such challenges. Unlimited clinical. Is my voice audible to all? Yes?
Yes, madam. Yes, please continue. Madam, yes, please continue.
Okay. So coming to the lack of awareness and recognition, many people, including doctors as well as the patient, don't fully understand how homeopathic works or its scope. So that is the real problem we are facing. And because of this, homeopathy sometimes doesn't get equal recognition compared to modern medicine. Young clinicians have to face challenges of explaining and creating awareness about its effectiveness and need for continuous professional development. So what actually happens here is like young clinicians, limited exposure, right? So after completing VHMS, students often get more theory than practical experience. And in some colleges, opportunities for handling real patients in clinics are less compared to allopathic medical colleges. And when they graduate, many young homeopaths feel underconfident in clinical practice. So they lack confidence in practicing too. And need for continuous professional development. Actually, they need to grow with new researches, new approaches, and integration with modern technology. Doctors should update their knowledge and skills regularly. And also, with patients, expectations are more from the doctors, right, in today's healthcare. So we are been working hard to achieve that actually. So coming back, what was it? Like challenges, right, faced by them. Lack of awareness, recognition, limited clinical exposure, and need for continuous professional development. Then coming to the next slide. Yes. So you'll have to move a step forward, right? So how? Collaboration with other healthcare systems, focus on public health and preventive care, innovation like mobile clinics, health apps, and researches, right? So we'll be talking about collaboration with other healthcares. Homeopathy doesn't work in isolation. It is a complement to allopathy, Ayurveda, yoga, and naturopathy. The patient who is getting medicine for diabetes are taking homeopathic medicines too, right? So these medicines, homeopathic medicines, are given for their mental stress or for diabetic neuropathy, though they take the allopathic medicines regularly. Such an integrated care improves patient's outcome and patient builds trust on doctors. Here, next one is focusing on public health and preventive care. Holistic lifestyle changes are necessary now. Building immunity and early intervention means early medicines are needed and preventing them suffering from such diseases. And also homeopathy for recurrent colds in children and preventing remedies during seasonal epidemics are possible. Here, this reduces the burden and supports primary healthcare goals too. So, as a preventive care, homeopathy works at its best. Then coming to the innovation, mobile clinics, health apps. Nowadays, it is so familiar. When we started practicing after completing VHMS, it was very hard for us because we need to wait for months together to get new patients. So when we started up a clinic, there were lack of awareness too among the public, and we need to explain to each case what is homeopathy and how does it work, everything. But nowadays people are knowing what is homeopathy, and moreover mobile clinics and through health camps, they know that homeopathy can help them. Okay, so after this digital technology, we people are also improving in skills. Mobile clinics in rural areas where hospitals are not available, it is very useful. Whereas health apps like teleconsultation, reminder for taking the medicine, and patient education, everything we need to understand in a positive way. And also research work. Research work in what way? Like documenting the clinical cases and conducting the studies regarding that, publishing papers. So these things strengthen the evidence for homeopathy. Okay. So all these things are really innovative. So young clinicians should focus on these things nowadays. So altogether, in short, future of homeopathy in primary healthcare lies in working together with other systems also, focusing on prevention using modern innovations like apps and mobile clinics. So coming to the final slide, here is your conclusion. Like young clinicians are the backbone of future healthcare. Homeopathy plays a strong role in primary healthcare delivery and empowering yourself to empower homeopathy. Hope you know the meaning of empower, right? So giving some strength, confidence, and ability to do something of their own. Like a teacher empowers students by giving knowledge and confidence to face their exams. We homeopathic doctors are giving much knowledge and making them confident to come out of the disease conditions. So in clinicians, those who are the backbone, they have a fresh knowledge, energy, and some innovative thinking to the medical field. They contribute. And in this, homeopathy plays a strong role in healthcare's delivery by offering safe, affordable, and holistic treatment, addressing both preventive and curative. Okay. And when young doctors strengthen their skills, confidence, and commitment, they not only empower themselves but also uplift the entire system of homeopathy. So it is like learning a computer skill empowers a person for a better job findings. Persons who are working in primary healthcare delivery, of course, these people need extra skills to train up them, right? So that is what is necessary nowadays. And I hope this session is useful. In what way you can try to change yourself, and what are the extra skills you need to practice homeopathy in future, and in primary healthcare delivery, what you are supposed to give to the patients. So really, I'm so thankful for giving me an opportunity to ICIA, and I thank once again for patients listening. Thank you. Any questions? Any questions, please?
Thank you, ma'am. Thank you so much for the wonderful session. Any questions from the participant? They can comment in the comment box.
Everybody understood? So is it clear for everyone? I thought someone will be questioning.
Hello, 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 ma'am. Hello,
Yes. Yes.
ma'am. If we keep the clinic newly, ma'am, then how to improve the patients?
See, you need to put frequent camps.
Okay, ma'am.
Frequent camps, and you'll have to offer them a free medical treatment.
Okay,
And after the first consultation, you will have to give your visiting card to them. And for further follow-up, 1 week medicine has been given to them. And for
okay,
further follow-up, you will have to contact here. And it is nearby, and it is easy for them to approach. Or they
okay, ma'am.
can give you a call so that you can catch the patient ready.
Okay, ma'am. Okay, ma'am. Thank you, ma'am.
Thank you. Lavanya.
Yes, ma'am. Ma'am, how about the role of awareness programs, ma'am, regarding this delivery and all? Because I hope in the rural areas, in which the undeveloped areas among the village areas, they might be not aware of such care should be taken during the times in the PHCs. They will not also explain sometimes. How about the awareness programs, ma'am?
Yeah, government is KVT program. Tamilnadu government is arranging for a KVT program. In that, they are giving awareness on dengue, breastfeeding altogether. So they are giving free medicinal treatment also. So what being a clinician, what we people can do individually being a homeopathist, we can go for awareness camps in various colleges through Lions Club, Rotary Club, and also from schools and colleges. Recently, I went to a nursing college talking about the importance of breastfeeding. So when awareness was given, students were having most of the doubts cleared. So only by that we can improve. And also in rural areas, we need to conduct camps. Not alone the free treatment, we'll have to make them sit for 15 minutes. For 1 hour, patient will get distracted. 15 to 20 minutes, a short message will do to them. And conducting camps in rural areas will help us to improve our situation. So first awareness, then only treatment. Without knowing for what they are, and in school children's talking to them regarding cancer, because more deaths in child cancer nowadays. So next I'll be going for an awareness program on cancer for children's in schools. So that time when we tell them about what not to eat and what to eat, really students will understand the situation. At least after that awareness program, if one boy or a girl is getting changed, that is the benefit of conducting that awareness program. And we'll be saying the message very strong that you should not eat junk foods, don't take too much of sodas. So this content will enter to their brain. So definitely we will be able to create awareness by talking and conducting various awareness programs. And I'm damn sure that awareness program is must, because after conducting many of the programs for breastfeeding for the past 5 years, now I can see the difference. The people asking questions before even the basic line of treatment they can take, basic line of how to breastfeed. People are unaware of that. and new mothers exactly doesn't know what this all about. But nowadays people have changed and they have known many things. So after 5 years, I could see some improvement through this awareness. So awareness is very important. Yes, anybody else?
Thank you, ma'am. Any other questions from the participants?
Anybody has got any doubts? Anybody has got any doubts?
Hope they were clear with the topic, ma'am.
Yes, Pa.
So,
Yes, Pa. Yes.
yes, ma'am. So, thank you, ma'am. Thank you so much for the wonderful session, and it was quite useful for especially for the females who were actually in the stage of conceive. So, even though whatever the care should be taken during the delivery, post delivery, and before the care should be taken even for the child also after the delivery. So, thank you, ma'am. Thank you so much. So I hope everyone have a good session. Would be having a good session right now. And thank you, ma'am. Thank you so much. Thank you all the participants. So we'll be right back with the one more session tomorrow. Thank you, ma'am. Thank you all the participants.
Thank you all. Thank you for giving such an opportunity. Thank you. Thank you.